How can portosystemic shunt occlusion be prevented? Imagine a pathway that helps blood flow around a damaged or blocked liver, known as a portosystemic shunt. While these shunts can be life-saving, they sometimes become blocked themselves. Preventing this occlusion is key to keeping the shunt working well and avoiding complications. One of the most effective ways to prevent shunt blockage is by using covered stents made from materials like polytetrafluoroethylene. These stents act as a barrier, stopping tissue from growing into the shunt and reducing the chances of blood clots forming. Compared to bare metal stents, covered stents have been shown to stay open longer and work better. Choosing the right size and placing the stent carefully is also very important. Doctors often select a stent with a diameter that balances good blood flow with minimal stress on the liver. For example, using an 8mm stent instead of a 10mm, one can lower the risk of side effects like confusion caused by too much shunting blood away from the liver. Precise placement ensures the shunt stays open and functions properly without causing additional problems. Regular follow-up is another crucial step. After the procedure, doctors use imaging tests like ultrasound or venography to check the shunt's condition. If they notice narrowing or early signs of blockage, they can perform minor procedures like balloon angioplasty to open the shunt again before it completely closes. This proactive approach helps maintain long-term shunt health. Advances in interventional techniques also contribute to preventing occlusion. Newer stent designs that expand in a controlled way help keep the shunt open without passive enlargement, which can cause issues. These innovations help ensure consistent blood flow and reduce the chance of complications. Managing the flow through the shunt is equally important. Sometimes, too much blood bypasses the liver, leading to complications like hepatic encephalopathy. Procedures to reduce shunt flow or close off other abnormal blood vessels can help keep the shunt functioning well and prevent overload or dysfunction. In some cases, especially with complex or congenital shunts, careful assessment of the anatomy guides the choice of devices. For example, the Amplatzer device can be used to occlude specific shunts safely, based on their size and flow. Proper planning helps prevent unintended blockages or other issues. In the context of liver health and liver cancer, keeping the shunt open and functioning reduces the risk of recurrent symptoms like bleeding from varices or fluid buildup. This supports better management of portal hypertension and overall liver health. In summary, preventing portosystemic shunt occlusion involves using advanced covered stents, choosing the right size, performing regular monitoring, applying technical improvements, and tailoring treatment to each patient's unique anatomy. Always consult healthcare professionals for personalized advice, as each case can be different. Following these strategies helps ensure the shunt remains a safe and effective tool in managing liver-related conditions.